Hey guys, we're going to finish the notes that we did not get through today in class. So I think the last bone marking that we talked about was a head, and I'm not sure if we did all the details or not, so I'm going to go back over that one. The head of a bone is going to be a rounded projection on a skinny neck, and it's very similar to how our head sits on a skinny neck. The most obvious one in the body is going to be the head of the femur. In the center of the head of the femur, you're going to have something called a fovea capitis, and that is for tendon attachment. You can see where this green mark here, that would match to that green line right there in the joint where the head of your femur would go into your pelvis. The head is typically covered in articular cartilage, and remember that is for a smooth gliding surface whenever those joints articulate. The next one is a facet. A facet is flat. Think about a facet starting with an F and a flat starting with an F. If your vertebrae have to stack on top of one another, where those two bones meet must be a flat surface, and the name for that flattened surface where vertebrae are going to sit on top of one another is called a facet. You will have a superior articular facet and an inferior articular facet where one vertebrae is on top and one vertebrae is on the bottom. Next we have a ramus. We are not going to do a ramus in this class, so you can cross that box out of your notes, and that'll be one less that you have to worry about. Let's keep going to a condyle. A condyle is a rounded end of a bone typically. The most obvious ones in the body are the condyles of your femur. You will have a medial and a lateral condyle on the femur. I know that the medial condyle will always be on the same side as the head of the femur. So this is always medial. On the inside, the outside or further away from the midline would be your lateral condyle. This is how you are going to bend your knee, because those condyles are going to make a connection with the tibia, and it will allow you to hinge your knee back and forth. You also have condyles at the end of every metacarpal and metatarsal. So where your finger meets your palm, that is also a condyle, or where your toe meets the middle part of your foot, that is also going to be technically called a condyle. Next we have a fossa. A fossa is almost like a bowl. It's called a shallow basin-like depression, but what that means is that there is a bowl or a scoop out in a bone. If you compare these two pictures right here, you can see the picture on the left has the jawbone in place. The picture on the right is where the lower jaw has been depressed or opened. The jaw, the top of your jawbone is going to fit into the rest of your skull, and the part that moves in and out of that joint fits perfectly inside of the fossa. If you put your hand right in front of your ears, kind of where you would close your ears on your little ear holes, if you open and close your mouth, you can feel that mandibular condyle going in and out of the fossa that is created for that bony projection. So it is a bowl-shaped depression in a bone. You also have one on your elbow. When your arm is bent, your elbow is poked out. But when you straighten your arm, that olecranon process or that elbow bone has to disappear somewhere, and it is going to disappear into the olecranon fossa. The last set of bone markings that we're going to do are bone markings that allow for nerves and blood vessels to pass through them. This would obviously have to be a groove through a bone, a hole through a bone, there has to be some way for a blood vessel or a nerve to travel against, down, or through the bone. First one is called a meatus. You do not pronounce it meatus, although that's what it looks like. This is going to be a canal-like opening, similar to a tunnel that you might drive through. The only one we'll talk about in this class is called the external auditory or external acoustic meatus. And that's going to be the hole in the side of your skull where sound waves can travel through to your brain. They will make a connection and really transmit that sound wave to a nerve that will then travel into the temporal lobe of your brain, where your brain's going to interpret what you are hearing. But that meatus is very tunnel or canal-like opening on the side of your head. You can see it circled in purple right there. We will also cross out this slide as well, so we won't do a ramus and we won't do a sinus. So keep moving. We have a groove. Okay, a groove is not a hole. It's not a tunnel. It is just going to be a ditch or a furrow or a valley in a bone. We talked about the greater tubercle being on the outside of the humerus, the more lateral surface of the humerus. On the more anterior and medial surface, you have something called your lesser tubercle. Remember, when things are named greater in the body, that means they're bigger. When they're named lesser, it just means that they are smaller. Well, in between those two tubercles, or the rough rounded spots on the humerus, there is a groove. The stem inter means between. Tubercular comes from tubercle, and that is a groove where a blood vessel and nerve is going to kind of follow that blue line that you see on that bone. A fissure is next, and a fissure is not a hole, it's not a tunnel, it is going to be a slit like opening in a bone. If you look inside this orbit, okay, so this is the orbit of the skull where your eyeball would sit, there is a fissure in the back called your superior orbital fissure, and then there is a hole right beside it. Look at the difference between the shape of the fissure versus the shape of this hole. So a fissure is going to be more elongated and skinny. The name for a hole we're going to do in just a second, but that would be for blood vessels to travel out of the back of your eyeball and through that slit. A foramen is a hole. A foramen is one hole in the body if you are in a bone. If you were to need to name more than one, you would not say foramens with an S, you would call them foramina, and you would change the ending to I-N-A. Here are some examples of foramina in your body. There are two above your eyeballs. Those are called your supraorbital foramens. You have infraorbital foramens too. Supra means above, infra means below, and those are going to be where some of your facial nerves travel through the bone from your brain, which is why you get the sensations that you do, that you feel your face or allow movement in your face. Down on your lower jaw, on your mandible, remember your chin region is called the mental region, and you have two foramina on your mandible, one on the left and one on the right, that are called your mental foramina or mental foramen if you're just looking at one of them. When a dentist gives you a shot in your jaw and numbs your mouth, he is going to give you that Novocaine close to that mental foramen because he knows that's where anatomically the nerve is that's going to cause you to have sensation in your lower and upper jaw. A notch is one of the last ones we'll do. A notch is a V-like depression, so it's going to be more V-shaped than a foramen, which is going to be circular, than a fissure, which is going to be a slit, or a, which one am I missing? Or a groove, which is not an opening at all. Look at the end of the femur here. The end of the femur is going to have a notch. that runs between it. And you can see this V or U-shaped depression on a bone. And the last slide is just some general terms. The one that I want you to pay the closest attention to is going to be the one that says process. On Thursday, Friday, we're going to do a bone marking lab, and you're going to think that there are no more bone markings but processes, because we do so many processes in the lab, and there's so many to learn in the body. But a process is typically pointed in the body, and it is a raised area. We're going to have a styloid process that is on the back of your vertebrae. It's also on your ulna. It's also on your radius. And there's going to be a lot of pointy points on bones, very distinct points, and most of those are going to be called a process. So make sure you know that definition, and then we will get more practice with the individual bone markings that you're going to be responsible for. Don't forget to do your ILA for homework, and let me know if you have any questions.